Okay, let me show some quantitative data of this window of 5 years that we have in the middle of the socio-economic crisis. It's not enough to have and to take conclusions, but maybe there are data that we need more and more data, not only from the quantitative point of view, but the qualitative spatial view. And first, I present, of course, my disclosure. I obviously show that I have money from the different pharma industry companies, also from European projects of FP6, FP7, and now we are at the beginning of Horizon 2020, as you know. But also I received money from the Minister of Health, Minister of Economy and Innovation, etc. That's, I have obviously conflict from the economic point of view, but for this viewpoint, I think is not very important. My contents of the presentation pretends to show you the rates of unemployment in Spain, because we are the highest rates on the European community. Unfortunately, we are reducing quickly. We have suicide data, we have psychiatric care, the impact on psychiatric care, special level. We have data from the primary care, and we have also data of the consumer on antidepressants rates, basically for primary care people. Because in psychiatry we have a little increase, but the big increase is from the GPs, from the general practitioners. And finally, I have only 2-3 slides to organize the discussion. And as conclusions, maybe next year we will talk about it, because at this moment it's not possible to conclude. Okay, first of all, what we really know about this impact, environmental situation? Our outcomes, our health outcomes, currently worsened in the context of aftermath of the financial crisis. This is, it is possible to accept this motto. But the association between suicide rates, of course, and employment is not clear and maybe controversial domain. But there are other psychosocial factors involved that we could talk during this debate. From the employment point of view, as you know, between 2007 till 2012, we traveled in Spain from 8% of unemployment to 26% in 2012. This is the highest rates on the European community. Now we are not in 26, fortunately, we are in 18. But it's very, very impact for our Spanish populations. But since the onset of this socio-economic crisis, austerity measures have included salary reductions, healthcare personnel reductions, change in drug prescribing policies, and delays in payments. Obviously, it could influence those things. There are good papers made by Houston and published in British medical journals 3 years ago. But about the graphics, what are the situation from 2005 to 2014? As you know, we increase progressively, but now we are in the decreasing, this curve. And it's very important to know what is the initial point on the unemployment and where we're changing from the last 2 years, 2013 and 2014. That's interesting. And the two curves correspond to males and females. Males is in blue and females in yellow. That's very interesting to take into account for discussion. Well, really, we have evaluated from the mental health point of view in the last years from the socio-economic crisis. let me assure at the beginning that we have no changes on the demand at the specialized level, at psychiatry level. We have the same number of demands, people taking to psychiatric care. We have the same rates of depressed people, same rates of schizophrenic patients, we have rates of anxiety disorders, etc. But in this other level of assistance, primary care level, the things are totally different. There are a big demand of mental health, uncomfortable people who ask for medical solution, for medical treatment, as I can demonstrate in the next slides. But the environment of this situation accept that the crisis is modified by micro socioeconomic level factors, obviously also for social factors, macro socioeconomic level, but we really don't know clearly which is the main factors and the main components of this influence. But in the later financial and economic crisis, there are, and its consequences, there are associations, particularly with the suicide rates. Suicide rates is one of the positive association has more demonstrated. In our case, unemployment and suicide varies across countries. This is very important because not every country has the same rate, but also in regions. In Spain, we have, yes, a mean rate, but there are, the main rates are, the highest rates are in the north, not in the south. But in the south is the highest rates of unemployment. And this is in the past. This is a characteristic for countries, for regions. Because when we group countries or continents, etc., maybe we lose the good window to maintain this observation on the phenomenon. But at the end, we know the effect of these factors are not simultaneous. This is very important. If we see the phenomenon the first year of the crisis, maybe we don't notice anything. But after 5 years, we began to notice the impact of those situations on different people. But it's very important that it's not immediately effect. There are things first and others at the end. We respect suicide data because everybody are publishing suicide data, etc., and we accept that suicide data is perfect. It's a good representation of that one country, that one region, etc. But it's necessary to see this data with cautiously because the government agencies are not very true and very good agencies to demonstrate really those data. But take into account that it's necessary to be cautiously here. We need to take into account the numbers, of course. We have in Spain from 1999 and 2012 this phenomenon with respect of suicide rates. On blue, you have the total of suicides. There are no changes. We have the rates of people with job age, people from 20 to 65. It's necessary to divide people in age on job age from the other one because the youngest that are outside of the job market. And this is the unemployed rates. As you know, a big increase from the last 5 years, of course. On green is jobless. But one first thing that we notice in Spain is that the phenomenon has more influence in men when they lose the job than in women. two graphics, same country, and the increase is different in men than in women. But also, this problem of these same images you could find if you take into account the gender. In the case of the ladies, we cannot associate any correlations. We have only the correlation in the case of men, and particularly the elderly men, people after 50s, because they maintain more and more time the jobless conditions. Only two things, in order to take into account that the phenomenon is very complex. We are just at the beginning of the analysis. We have only quantitative analysis, and it's necessary to take into account those kind of things. In summary, annual changes of employment are positively associated with the annual variation of suicides before and after economic crisis. Before and after. Because crisis is more than a loose employee. There are a lot of psychosocial variables influencing this kind of phenomenon. The second thing, in summary, is that this association varies among gender and age group of the study population that we have. But it's obviously necessary to take into account the region, not only the country, because the rates of our country are very different. We have specific regions with higher risks of suicide from traditional point of view, and it's necessary to take into account, of course. Let me move to the primary care. What happened with this situation? Because we have two cross studies, one made in 2006 and the other in 2010 with the same group of research. It's a group from Mallorca, led by Miquel Roca and Margarita Gili, but in combination they prepared those two papers. One is in the European Journal of Public Health in 2012, and the authors also involved is Martin McKee and David Stackler. As you know, there are two very important people from England, from London, which describe those situations and participate in the analysis. The name of this study is Impact Study. It's on the general practitioners levels, primary care level. And in primary care, mood disorders, anxiety disorders, somatoform disorders, and of course, alcohol abuse or alcohol use increased significantly during these 5 years of socioeconomic crisis. The rates, as you know, they are particularly in the drug abuse, but also the increase in these two cross-sectional studies are 2% more in depression, major depression, dysthymia, etc. More things. The rates in Spain of those primary care mental health levels are major depression, dysthymia, general anxiety, and somatoform disorders. I don't know if in Italy you have the same rates, but this is our situation. This study was made by more than 5,000 people from all of Balearic Island, and it was involved more than 1,000 GPs, 2 times, 2006 and 2010. The other parameter that we could take into account at this moment is what happened with the antidepressants. And as you know, the antidepressant is growing up, but less than in the past. There are a decrease respect the increments of the first of the decade. In synthesis, we have a decrease of the previous increase, but the number, the total number of millions of units are increasing, of course. Other things that we have in this situation, one is increased use of antidepressants in the last years, but we have not increased in the number of suicides in the general populations. We have not increased in the number. We have a decrease. We have a decrease. That's totally unexpected, but we have some explanations for these kind of things. And the decrease, as you know, we have at the beginning, because we have around 8%, around 8% of 8 per thousand at the beginning, but now we are here. In the last 4 years, we are decreasing the rates of suicide rates. No attempting suicide rates. And this is an article, interesting article from José Luis Ayuso from Madrid. And we expect at the beginning, the upper bound, because the crisis began here, and we expect that the crisis increment the suicide rates. Not at all. But the lower expectation may be moderate increasing, and the real dates are lowering than the past rates. We don't know exactly what is the explanation, but we are lower rates than in the previous years before the crisis. Here is 2007, and we are lowering the rates in the last years, but also during the socio-economic crisis. This is published in The Lancet, not in Lancet Psychiatry, but in The Lancet, in 2030. Let me, in order to promote the debate, bring the new paper just recently, because it's from this month, the North paper. There are a big discussion open now after this publication, because they divide the 63 countries in 4 continents, or in 4 world regions, and they obtain the same situation. The decrease of this situation is 1.1 in comparison with the previous years. They include 2000, 2011. We have a decrease of 1.1 of rates of suicide. That's interesting, no? And in contrast, when they include unemployment, there are an excess of suicides in the group of unemployers. There are an excess of suicides from since the economic crisis, take into account the beginning of the onset, 2008. The other thing is not the conclusions, but is in the same paper of Lancet Psychiatry as the previously, the North, and I think it's a very reasonable proposal. First is recognizing that we need better data, of course, to understand psychosocial manifestations of the economic adversity, including non-fatal self-harm. Suicide rates is okay, but maybe it's a hard outcome, and maybe we need more qualitative outcome measures. We could include helplessness, we could include alcohol problems or alcohol intake doses, we could include familial conflict, relationship breakdown, etc. In order to have a comprehensive vision of what happened in the middle of the crisis or after the end of the crisis, because for us in Spain, we accept that we are in the last year of the crisis. And we also need, of course, what happened with the resilient people, because we know, everybody knows, people will resist perfectly and they manage very good, and they live with favorable mental health conditions, with a very good quality of life, etc. This is my proposals to debate. Thank you very much for your attention.
you.